Hello, good evening, everyone. Welcome to my IVF Answers and the European Fertility Society. We are back with Dr. Alan Thornhill, and I'm really happy to have you back. It's another interesting and not an easy topic as well, but I know that you are the perfect person to discuss this. You've been in the field of fertility and, of course, IVF clinics. It's nothing. I don't think there's anything that you don't know. So it's like you are kind of inside man as well, and outside of it as well, let's say. So I think you are a perfect person to discuss this, and I'm really happy that we are talking about this kind of question: do you trust your clinic? Because it can be tough. It can be quite difficult as well. I think, it sounds like a difficult easy question, but I think there are lots of things that make people wonder how it works inside as well. So thank you so much for bringing this topic for today. And of course, today we will start with Alan, and he's got some tips for you, but afterwards, as always, there will be time for your questions, so you can ask Alan anything. I'm sure he'd be happy to discuss it today. Alan, great to have you. How are you feeling? Ready to discuss this topic?
Yeah, good. Thanks for the introduction. Thanks for the invitation. Yeah, this is kind of a controversial topic. I've on purpose I've chosen a title that's a little bit provocative, because by asking the question, "Do you trust your clinic?" the suggestion is you shouldn't. That they're not trustworthy. And of course, I'm going to tell you straight away that most clinics and most people working in clinics are very trustworthy, and you need to trust them. How do I get to my presentation? Sorry. Do we need to change the...
Yeah, you can. Yeah, you just need to, I think you need to start sharing your screen once again, okay? Because
I'm on screen sharing already. Yeah.
Okay. And can you close it and try again? Because that way it will be just easier,
Okay,
I think. Yeah, let's do that so we can see it.
Okay.
So please bear with us. We will.
Okay.
Yeah, we have it here. It's full screen now, so we can go ahead. And as always, before we start, Alan, sorry to interrupt you, but just want to remind everyone that it's recorded. It's all anonymous. So if there are any comments or things you want to share, or simply ask any question, there will be time for it. So don't hesitate. And Alan, over to you. You are the right person to discuss it. So let's go for it.
So I've worked in a number of clinics. I've visited hundreds of clinics. And, on the whole, I think they're very trustworthy and they're trying to do the right thing. But the reason I've, got this title is because it only needs one clinic, one person in the clinic, one incident in a clinic to make you lose that trust. And that's why it's so important. And I think you need to be empowered, aware. You need to be your own advocate. It's good to have support and other advocates, which I'll go through, but you sort of need to understand that things might not always go the best way or the way you want them to. And today is about, if you're not already doing it, is about learning how to sort of tune that. I call it the BS detector. When you smell something not quite right, it's often because there is something not quite right. So I've called it building, training, and tuning your BS detector. So what we're going to cover, we're going to talk a little bit about trust, why it's so important, but it's quite easy to lose. And you could talk about trust in almost any arrangement where there's like a transfer of goods. When you go and buy something, particularly something expensive or particularly something really important, there's often a trust between the buyer and the seller. And in IVF, that the stakes are so much higher, or in fertility treatment, the stakes are so much higher that trust is super important. I'm going to give you some reasons why you probably need a BS detector. It would be great if you didn't have to have it and you could trust everybody, everything was standardized, but that's not the case. I talk a little bit about ensuring transparency and honesty in IVF. And spoiler alert, it's two-way. It isn't just about you trusting the clinic. It's about you being honest and transparent with them as well, because I think you'll get the best. And if I was working with you, I'd be telling you, be as honest as possible, because you will get the best treatment and the right treatment for you if you share everything that's accurate and honest and truthful. And then this little thing, which is kind of a bit of fun, but I think this is probably the most useful thing in the presentation: 15 tips where you can use your eyes and ears and the letter I. So all the words begin with I, so they're hopefully easy to remember, which is part of your BS detector. So using those words, you go, okay, ask myself those questions when something is said that doesn't smell quite right. And we'll go through those. And then a little thing I call the power of S, which is just a kind of almost like a summary of some of those things. And then we're going to end up with talking about bring your own. And of course, bring your own starts with bring your own BS detector. And then a little bit about next steps. So trust, it's so important, but it's very easy to lose. The vast majority of clinics, as I've already said to you, and their staff can be trusted, and they want the best for you, not just because they have inspections and regulations keeping them honest. They're an honest bunch. They're people who really want to help you most of the time, by and large. But the fertility journey does create a lot of stress, vulnerability on your part, and loss of control. And that's why the trusting becomes even more important than any simple transfer of goods. Infertility and its treatment is very personal. You know this, and the stakes are very high. So that just ramps up that need for trust even more. The treatment is financially, physically, and emotionally demanding, and so that just puts you on the back foot in most of these situations. And it's true that this is true of any kind of healthcare, but particularly in fertility treatment, the relationship between healthcare provider, let's say the clinic or the doctor working in the clinic, and you, the patient, is based on trust. And it really needs to be. It shouldn't just be a simple transaction. But I would say the most common ways for trust to be broken are poor communication, which doesn't necessarily mean you're being told lies. It just means that there's miscommunication. It's not coming through loud and clear what's meant to be happening. Misinformation, so whether that's intentional or unintentional, information that's not quite correct and it's really not helping you and it's actually causing problems. Incidents where something actually goes wrong and how and whether that is transmitted to you, and insensitivity. They're just some examples. There's many more, and I'm hoping at the end we can do a little exercise where anonymously, hopefully, you can maybe talk about some things that have happened in your journey that you weren't very happy about and what happened next. Not in detail, but just to get a sort of flavor. So why do I think you definitely need a BS detector? Because IVF is not 100% successful. That's one reason. So if it was always successful, yeah, you might be disappointed if somebody was a bit untruthful with you or not clear with you, but you say, well, I got the result I wanted, so it doesn't really matter. But it's not successful all the time, and that means that you want the process to be as straightforward, honest, and transparent as possible. IVF's not standardized. And why that's important, it's not just to do with success or not, it's that it means there's lots of extra things and there are differences between clinics and in different countries. So you can get lots of different add-ons, different drug regimes. I mean, we could go on and on about the differences. And because of those differences, you definitely need something, an instrument in your own head to say, does this sound right? Do I believe this? Do I think I'm being told the truth here? A good example, headline IVF costs, we've covered this in another webinar, but it's useful to use it again, is rarely the price you actually pay. So you could say, tune that BS detector to understand your likely costs for a cycle, tune it really, really highly, because the evidence from Fertility Mapper in the UK demonstrates that the average cost that is estimated by the clinic is about 3,900 for headline IVF. And the actual cost paid for the average patient is 9,500. So almost 3 times as much. So there's a good example of, it will be good to know exactly what the costs are going to be. And you may need that BS detector working to get that number. Clinics are more commercial than they ever were before, and they're under pressure to deliver profit. So you can read between those lines and work out that maybe there's more BS floating around. Maybe there's more stuff that isn't quite 100% true, and you need to get to the bottom of it. So at least you're informed. It's one thing to say, I'm offering you an add-on, it's going to cost you £5,000. It might not work, but let's have a go. That's at least honest. But if it's like, oh yeah, everybody who has this, it works. It's only a fraction of the cost you would pay for multiple cycles. That's kind of, you can smell something's not quite right there. And I would say challenging the plan, which is what's going to happen if you've got a finely tuned BS detector and you're really asking the right questions, is, I say could, but it's almost certainly going to save you time, money, and energy. And I've put energy in inverted commas because it means a lot of different things. Time wasted, physical, put your body through treatment cycles, all of that stuff. So very briefly, just in case you haven't been to one of my webinars before, I'm a registered clinical scientist, trained as an embryologist, been in the field for more than 25 years. So in that sense, I'm quite different from a lot of coaches who are popping up all over the place. So I like to call myself an expert now instead of a coach, because otherwise it's hard to differentiate. More than 100 publications and scientific reviewer in IVF and related fields. That's relevant because I can keep up to date with the new advances, not all of which are heavily evidence-based. I've had clinical, commercial, academic, and regulatory roles in IVF, as well as working in the clinic. So I see things in the round. Worked in many different countries and worked for global companies. So I know that things are different in different countries. And that means I've been involved in the fertility journeys of thousands of patients at some level. So I've kind of seen pretty much everything. And if I haven't, I've got a good approach to kind of try and deal with it, or I know somebody who can help. So there's plenty of things I don't know the answer to, but I almost certainly know someone who can help with it. And I'm independent. So transparency and honesty in IVF. Who am I talking about? I mentioned at the top that I don't just mean staff, I mean you as well. And that's not to say I think you're all, not giving the right information to your clinicians. I'm sure you're giving as much information that you think is necessary. But I would say, absolutely be as honest as possible. Give a full detailed description of what's happened in the past, because that's the best way to get the best help. Communicate all the relevant details, medical and reproductive history, but also really importantly, and this is like the boundaries webinar that I've given before, and you can catch up on what you really, really want and what you don't. And many of my consultations, that's what it comes down to. Actually, people say, they're not just saying, does this work or not? They're saying, well, I've been asked to do this, but I really don't want to do it. Okay, good. We found something you really don't want to do. So let's look at that a little bit more and make sure that that's communicated to your clinical team. What are the cost limitations, risks, complications, and side effects? And these basically form the bedrock of questions that I always want you to ask when you come up against something that's not straightforward or doesn't look like the right thing for you. If you keep that list close to hand, it pretty much applies to everything: treatments, drugs, different medications, and so on. What are the possible benefits, the likely outcomes, and the clinic experience? So those are all the sort of relevant details that you want communicated in both directions, not just you're telling the staff, but not just they're telling you. And why is this important? Well, it's kind of obvious, but it's ethically the right thing to do, and it's practical. Sharing information properly means that you're going to get the most efficient and hopefully best outcomes, efficient process and best outcomes. Plus, it builds mutual trust. So you know that when you have a good communication with somebody, that you start to build trust with them. And if you look at the emotional side of it, absent or vague information usually causes anxiety, distress, confusion. That's pretty much 50% of stuff that I talk to people about. And then if we talk about the financial part, because we know that's so important in a treatment that is in most cases not free, hidden, unexpected, or extra costs create shock, stress, and sometimes stopping of treatment. And studies have shown that people who understand, just to use this one example, costs are better prepared and experience less stress. So a lot of this is about expectation management. If you know what to expect, a little bit informed, then that can reduce the stress and the anxiety surrounding your journey. And I will keep saying this throughout the talk. I want you to be skeptical. I mean, in the Q&A session at the end of this, I'm totally happy to be challenged on things. I don't have all the, perfect answers to everything, but I will, say things that I believe to be true and with all honesty and transparency. But I want you to be skeptical. I think that's a really good position to go into whenever you go into treatment. So what are some things you can do to verify information and ensure transparency? Well, first of all, be proactive. Any questions or doubts, act on them early. As soon as you have a doubt, don't let it fester, deal with it straight away. Do your homework. IVF 101, the basics of IVF. You don't need to become an expert, but you really, to be able to ask questions, you do need a basic understanding. Unfortunately, that's the truth of it. Conduct independent research or consult third-party organizations, and I've got some of those in the reference section at the end, for things like accurate success rate information for your age group or your particular fertility issue. It may not be absolutely precise for you, but it should give you an indication, i.e., for example, older women are likely to have lower success rates. It's that kind of sense checking thing. I think it's really important to start learning to challenge, say no to something you're not happy about, and seek second opinions. You should be in the driving seat here, particularly if you're paying for the entire cycle. You are the customer who needs to be listened to. And before committing to any treatment, have a budget and fully understand the costs. Ask for all consent forms, costs like a costed treatment plan, and the treatment plan itself in writing. Try not to just get things verbal. Try to get things in writing, because that's something you can always refer back to later. And I would say at all times, try and maintain an open and honest communication with clinic staff. You're going to get the best from them. They're human, right? And sometimes they have bad days. Sometimes things don't go well, and you're going to get the best for you if you deal with them in an open and honest way, and you've got the best chance of getting openness and honesty back. And that's from an insider. So I'd like to say that everybody always does their best every day, every minute, every patient, but that isn't always the case. So if you want to maximize the odds of it being for you, then there's a little part you can play in that too. So let's get on to the 15 tips. So this is using your eyes, ears, and the letter I. So here's our little BS meter at the top, with some funny sort of funny parts on it to say whether we believe what's happening or not. And I think if you use these, any or all of these, whenever you're told something you don't quite believe, you're probably going to get to the bottom of it quite quickly, which means then you ask more questions. It doesn't mean you just walk away unless something terrible happens. It means you ask more questions. So first of all, incongruent. So another way of saying this is incompatible information. And I've got a good example for this. I was working with a client who was told that they would have ICSI. And I said, well, what was the basis for that? And I wasn't trying to second guess it. I didn't have access to all the information. But they said, oh, we've been told by the doctor that the success rates for fertilization for conventional insemination, conventional IVF versus ICSI are vastly different. And I said, well, that's basically not true. But the incongruent part here, so this could have come under lots of categories: inconsistent, incongruent, untrue. But basically, when we we listened to what different people in the clinic said. One person said it was 40% success fertilization rate with IVF versus ICSI versus 70% ICSI. Another person said it was about the same. Another person said it was 60% versus 70%, which is not hugely different. And when we looked at the patient information sheet, that said something different again. So all these things were not consistent or congruent with each other. So that was a red flag. And I said, well, you need to ask why you're actually having ICSI here. It turned out in the end that it was preference of the doctor, which comes up later. Inconsistent. Different staff say different things. It could be about almost anything. Well, the same person says something different on a different day or each time. They're contradicting themselves. So inconsistent information, you can't accept that. Don't just go, oh, I must have misheard it. Challenge it. Inaccurate information. You know it to be not factually correct. It's actually wrong. And this is just an example. I don't think this is true, but I'm just using a type of example where someone would say, oh, you want donor sperm? Oh, yeah, you want it from Denmark? Oh, no, we can't do that. And if you know that's not true, you need to challenge it, because they might have their facts wrong, or there may be a reason why they're trying to get you to, buy it locally or something else. So don't accept things that you are pretty confident are factually incorrect. Something that's impossible, or we could put it different words, too good to be true. Again, this is just an example. Don't take this as, this is absolute, true statement. I'm just making an example. Sort of thing where someone says, oh, everyone gets pregnant at this clinic when we use, for example, immunoglobulin therapy. Well, it doesn't sound, it sounds too good to be true. It's almost certainly impossible, and there's probably not evidence backing it up, or certainly not published evidence, or the number of patients they're talking about might be 3 or something. Well, that's not really the same as a statement everyone gets pregnant. That's like the last 3 people we had got pregnant. And as I said, this isn't about immunoglobulin therapy. It's just to make a case in point of the type of thing someone might say. Or inexperience. And that's what I think you should definitely challenge this when someone says, oh, yeah, we started doing this last year, and say, well, how many cases have you actually done of this new special thing? Well, we've only done a couple of surrogacy cases, or we've only done a couple of PGD cases, something like that. Because inexperience, tends to mean that things aren't going to work as well as they would in an experienced center. So another inspection report. If the centre has issues, so you have certainly in the UK, but probably in other countries too, you can have it's public information. You can have access to inspection reports. I've dealt with this in a different webinar, so you can see more examples. I think it was the choosing a clinic one where I showed a clinic that had a really bad inspection report, and I said, you probably want to not go near this clinic for at least for a while. Maybe things will change, and you can read the new inspection report, and everything's been cleared up. But to me, if a clinic has a big red flag on its inspection report, I would steer clear of it. A centre doing something illegal, and illegal is a bit of a harsh term, but it can cover quite a lot of things. So strictly speaking, keeping a sample for longer than it's been consented for is illegal, because there's a law saying that you have to have consent to store things. So I know that might sound like they're stretching it, but my point really is, when a clinic says, oh yeah, we'll do that for you, oh yeah, we can do that, you at least need to question it, because although it looks like it's to your benefit, and it probably is to your benefit temporarily, but if they've broken loads of rules, it might lead to you not being able to use the sample later, for example. So, and it also might mean, if they're going to break that rule, what other rules might they break? So we are in certainly in the UK, a very compliant area of medicine, and you need to look carefully when you think something's being done that might impact you later. Internet. I often criticize the internet for having lots of information, and it's hard to curate it and get the best information. But I can give you a really good example of why it can be very useful. It's a good way to check for inconsistencies. So for that example I used earlier with the fertilization rate from IVF or ICSI, that's something you could do a quick search and probably get quite a few options, which doesn't mean you've got the answer. It means you've got a question to ask of the clinic. You can Google red flags. I think this one's really useful. So outside of an inspection report, if something really bad has happened at a centre, you'll probably find it if you do a Google on the internet. And I'll give you a very quick example, because I know we've got limited time. I was once working at a centre, and we had an issue in the laboratory. Some things went wrong, and as a result of that, we reported it to the HVA, and we dealt with it absolutely properly. But as a result, my management team decided to send in an external inspector, which is fine, although they didn't tell me or the lab that was going to happen. Now, this was it was a nightmare situation, honestly, and it still gives me nightmares thinking about it. But what was very interesting, though, is, and this is about 15 years ago, so this is for sort of early days of people using Google to find things out about people. And one of my embryologists came to me and said, I've just Googled the inspector, and he's sort of, I'm going to use the word wanted, but that's not really the right word. He's kind of wanted in another country for doing something bad and absconding, leaving the country. And it was to do with IVF. So it's like, what's that person doing inspecting our laboratory? This is like the worst person you possibly have to come and inspect your laboratory. And the reason I say that, I use that example, so it's not about patience, so to speak, is to say that, you can find out quite a lot. Obviously, check your sources and make sure it's all accurate if you do find something, but at least it gives you a question to ask. And of course, I asked the question of my management team, did you know this about this person? And they went, oh, no, we didn't. They hadn't done their due diligence. So it works at every level, doing your due diligence and checking things. Inappropriate, another I. Comments about race, sexuality, other protected characteristics, or odd behaviors. If you see that or hear that, that's kind of a red flag. Obviously. And it shouldn't just be a case of, well, it didn't offend me. It's like, well, it didn't offend you today, or what's coming next. So, I just think that's important to, if you hear anything inappropriate, that you see that as a red flag, and you're tuned into that. And lastly, for this section, I would say intuition. You're not going to become an expert. You shouldn't have to become an expert, but you can trust your gut. If your gut says, oh, something doesn't feel right here, listen to your gut. It's really important, because you do have to, if you're going to stay at this center for one treatment cycle or maybe 3, you've got to trust them. And if your gut is saying, I don't trust them, even if you don't have any evidence, you got to listen to that. So final 5. If something's improbable or implausible or unlikely, like all patients having treatment X got pregnant, I used a similar example earlier, then, you got to, trust your gut. It just doesn't sound right. Or ask a few more people, or ask for a second opinion somewhere else. Because if they say, no, that's just simply not true, and here's the evidence that it's not true, then you can go back to that clinic and say, I'm sorry, I don't buy that at all. Insufficient evidence. Now, this is an interesting one because, I sometimes talk about add-ons, and lots of people talk about add-ons and say, oh, there's no evidence. It's not true. There's quite a lot of evidence for many of the add-ons. However, it might be considered insufficient evidence. So, for example, the way add-ons are defined, without going into too much detail, is recommended for all patients, like routinely. So insufficient evidence would be, well, actually, it may be recommended and may be good for certain patients in a certain subgroup, but not for all patients. So there's insufficient evidence, and you'll get a flavor of that when someone's saying, "Oh yes, we use this for everybody," and you're thinking, "Really? There's not evidence for it working in everybody." Or question: Is there evidence for it working on everybody? And if it's like, "Well, no, insufficient evidence," red flag. BS detector on alert. Idiosyncratic or individual preference. So I used this one earlier. That same doctor who said, "Oh, the fertilization rates with IVF are very low compared to ICSI." That's only true if you had very, very poor sperm. But if you had no reason to use ICSI other than it was your preference, then you shouldn't get different fertilization rates. And ultimately, that doctor said, "I prefer to use it." And I admire that honesty, but that's what they should have said from the beginning. That's not evidence-based to say, "I prefer to use it." So you should be aware of that. If someone says, "I prefer to use it," okay, good. They've been honest, but now you can make your decision about whether you want to go with someone's, individual preference or whether you want evidence. And then the final two, someone being insistent. I strongly recommend you do this. Now, I've not gone for fertility treatment, but whenever I've gone to see a doctor in the last 10 years, I would say they've moved away from saying, "I strongly recommend you do this." In fact, you almost want them to recommend something. It's got to the point where you're kind of saying, "Well, what should I do?" And they say, "Well, you could do this, and that will have these benefits and risks. We do this," and you start thinking, "Well, can you just tell me what I'm supposed to do?" And instead, what I think is meant to happen is you're meant to go, "I choose option A," and they go, "Good. I think that's a very good choice for you." So if someone's insisting you do something, that's very unusual these days. So I would say that's at least a bit of a red flag. Then the final one, immediacy. And this is often true in sales when someone says, "You can get this massive discount, but you got to buy it today." That's a bit of a red flag. Obviously, it's a massive sales technique, but it does sort of indicate that they don't necessarily think it's the right thing for you, but they need to make a sale as quickly as possible. I've mentioned that clinics are becoming more commercial. I'm not suggesting they're always trying to sell things to you, although I'm sure some of you might feel that way, but about making quick decisions. I always speak to my clients and say, look, some things are time sensitive. I know it feels like the clock's ticking all the time, but making a bad decision quickly is not better than waiting to make a decision. It's still a bad decision. So when someone says, "You've got to decide now, you've got to pay today, you've got to do this now," that's usually not a good sign. And that's true in areas outside of IVF. So finally, the power of S, when to ask more questions. I want you to be skeptical. I always say this. You do need to build trust with your providers, but always keep one eye open for untrue, unlikely, or unbelievable information. Sense check. I call it sense checking. It could be true, but if it sounds too good to be true or doesn't match what you've experienced before, something doesn't seem right. Ask more questions. Or silence. You ask a really good question, it's met with complete silence, and this does happen quite a lot. I prefer someone to go, "You know what, I don't know, and I'll find that out for you," or I've forgotten, but I know we've got that information. But complete silence, as if you never said anything, that's not a good sign. And finally, final S, seek support. Friends, family, support groups, organizations, a coach, an advocate within the clinic, they can all help you discover the truth. And it usually comes from asking questions. So I want you, before you start treatment, or during treatment, or even after treatment, to bring your own BS detector, okay? I want you to think about having an ally, which is often a partner with you at all those critical times. Sometimes if you're just going for a scan, maybe there's nothing to talk about. But if it's going to be, important information imparted, decision making, questions to ask, go with somebody else. It could be family, friends, or a buddy. Could be a clinic advocate. I often find that counselors and nurses can often be good advocates for particular patients. Now, obviously, everybody's very busy these days, and sometimes this time has to be scheduled. But it's quite good to get in with a person who's kind of got your back. And then, of course, you could have somebody external, which creates that independence, a fertility pal, coach, or advocate. I've said this before in other sessions. Communication is key, and I think good communication is clear, specific. It's not vague. It's super specific and transparent. Who? anyone involved in the journey. I've already mentioned them. It's up to you. Remember, the clinic are not mind readers. They just want to help. Their opinions may not be the same as yours, and your friends and family may not have the same opinions as yours. So you've got to be clear about what you want and what you don't want. Be assertive about that. Learn to say no. And communicate issues and problems quickly. It's just so much easier to deal with them when they haven't been festering or they're very fresh. And put things in writing. I've told you that before. Do that by email. Then you've got a record. It really helps when it comes to the he said, she said part of any disputes. And it allows you to be in control of your story. So I think that's really important. I've showed this before. I show these resources not because there's lots on building your own BS detector, but this is a way of getting independent information from different groups. So a little exercise, and you don't need to do this now, but maybe you can put this in the Q&A or in the chat. Think of an incident or scenario in your fertility journey. That could be treatment or just your journey so far before treatment. And when I say incident or scenario, I mean something that you're happy about that didn't go well. And what did you do about it? And this is not for me to judge, to say, well, you should have done something. It's just, some of the options might be that you did nothing, and so you're still a bit annoyed about it. You complained, or you brought it up, but you're unsatisfied with the conclusion, or you complained and you got the issue resolved. So good for you. You got something sorted out. And the type of incident might be to do with what you paid, costs, billing, communication, miscommunication, a mistake. It's a mistake that happened, like you got the wrong drug, something happened in the lab, something didn't happen right on the day, or you got incorrect information. I'd just be kind of interested, or you can do this privately with me afterwards. I just think it's quite a good exercise to do in your head. So you got to ask yourself the question: what will your next steps be? You could always book a call with me or another coach. You've got nothing to lose. There's no obligation. I'm sure you'll learn something, and I think you'll probably save time and money. That's generally what happens when you speak to somebody independent. So we'll take questions now. Thanks, and good luck. Please follow me on Instagram if you want to watch a middle-aged man flumbering his way through videos. And it's been a pleasure to speak to you tonight, and I hope we've got some interesting questions. Thank you.
Thank you so much, Alan. I think that it was already useful what you shared with us, and of course those tips. Yeah, I'm sorry, I'm reading just a few questions here, and thank you so much for discussing this. As you said, it's controversial, but I think it's important that we also talk and discuss this part of fertility treatment as well, right? It's a complicated process, and I think that lots of people find that hard to actually find a clinic. Then if you have a clinic, you trust your clinic, or what to watch out for, what are the red flags. And some of our patients, Liz already asked 2 questions. There is some sort of oh yeah, okay, yeah, some comments really here. So let's go for it. And before we start, as always, I just want to emphasize that this is all anonymous, and Alan is simply here to make some suggestions, but also share his own opinion on this. So if you are not sure about this, if there's anything you wish to share, this is the time. So you can do it. And put this in the chat. So let's go for the first question from Liz, okay? And this kind of question comes quite a lot, and actually I think lots of people come to the webinars, our webinars, for the second opinion as well. Of course, we have this kind of discussion today, a different topic, but of course there are lots of webinars that we do that are medical questions, and I know for a fact that people come here to get the second opinion. And the question here is actually, when should I consider seeking a second opinion, and how can I do so without offending my current healthcare provider? Anything you can suggest here, Alan?
Okay. It's a beautiful question, because it actually has a lot of layers, right? There's lots of bits to that question. And thank you to the person who put the word bullshit in. I probably should say that.
Yes, of course. I forgot to mention that.
Yeah. Thank you. Thanks for the person who answered that. So this has got lots of layers, as I said. So first of all, let's go backwards. Let's say, how can I not offend my current provider? Okay, it isn't your job to not offend them. This is the first thing I would say. But I'm really pleased that you are considering it, because you're obviously a good human being if you're thinking, I don't want to upset them. And there's another practical part to that. I'm sure at the back of everybody's mind, and maybe your mind, but you don't have to confirm that or deny that, if everybody thinks that if they complain or don't, they're not completely compliant with everything, that maybe they'll be looked down upon, or maybe their treatment won't be so good in the future. I'd like to say that's probably not the case, but we're all human, right? So nobody wants to be the squeaky wheel, the person who's complaining, because it feels like you're not going to get the best treatment after that. I don't think that's true, but it makes perfect sense to think that way. If you're paying, and even if you're not paying, you have every right to question what's happening, and therefore you have every right to get a second opinion. So a second opinion, here's some more of the layers. You could say, could you ask this question if it's complex, and we don't need to get into necessarily the details of what this particular issue is, but I'll use some structural things to help with that. You could say, have you discussed this at a multidisciplinary meeting? So lots of clinics will, if it's a difficult case, if it's not straightforward, they won't just deal with it themselves. I think a good doctor goes to his or her team and says, I've got this really difficult case with Mr. and Mrs. X, and what would you do? And the person says, oh, I think that's exactly what I would do. I think that's a good approach. And then if they're a good doctor, they come back to you and they go, I spoke to the team, and the team thinks this approach is a good approach, right? Obviously you have to trust that they've done that, but I don't think someone would lie about that. I don't think they would. I think they would say nothing if they didn't do it. I don't think they would say, oh yeah, I did it, and lie about it. So you could ask for a multidisciplinary, so stay in the same clinic and ask for other people's opinions. You could stay in the same clinic and ask for a different doctor's opinion. And again, it's often about the answer that you get that tells you a lot. So if they go, no, we're not doing that, it's like, oh, okay, well, you've kind of forced me to go outside then, haven't you? Or if they say, oh no, we don't normally do, we don't need to do that, they're not really listening to you. Then another layer is about what I said about communication being really precise. Now, you and I'm not asking you to do this, but saying I want a second opinion, it has to be about something very, very specific. Otherwise, in essence, you're going to get a full consultation with all of the information, which is quite a lot to do to get a second opinion, which is almost like saying, it's so important to me to get a second opinion. I'm so disturbed, but one of these options, so disturbed by what I've been told so far, that I'm seriously considering going somewhere else. Therefore, I'm going to go through this whole procedure again, consultation. Hopefully not all the diagnostic tests again, but they're all going to be reviewed, and someone's going to make a summary of what they think should happen next. If it's, should I have IVF or ICSI, just to use an example, based on these sperm parameters, I think that's quite an easy one to get a second opinion on, because you could probably ask a very specific direct question. And I know the answer might be, oh, well, it depends on loads of things, but I think that's something you can probably get quite a clear answer on. So you see what I mean about how it's really layered. But and then the final part I would say is, if you're really unhappy, if this isn't just a kind of like, oh, I'm not sure if they're doing the right thing. If it's like, this is my last chance, the stakes are super high, then absolutely get a second opinion. Because if you don't, and you're unhappy, and you don't get the result you wanted, you are going to be sort of kicking yourself and going, I wish I'd got a second opinion. But this is very much a how long's a piece of string type question. There isn't a sort of set, this is where you get a second opinion, this is where you don't. But I would say, if it's someone going, oh, we've done this drug regime and we've tweaked it a little bit for the next cycle, unless you seriously, things went wrong in the first cycle and you thought, oh, that doesn't look like enough of an intervention to try and get a different result. If it's just a little tweak and actually everything was pretty much okay the first time, that's probably not second opinion territory. I mean, but I think it's all very personal. I think it's very personal to and very specific to the actual case and condition.
Yeah, thank you so much indeed. I think that it's a complex question. Thank you for sharing your thoughts on this. And as you can see, Liz has one more. And actually, our next patient also is mentioning the costs, right, and transparency here. So let me go for Liz's question here. So how can I assess whether a clinic is being transparent about my treatment options and the associated costs? I believe that sometimes it can be, hidden, as our next patient actually mentioned here as well. So any tips on this?
Okay, so what I would say is definitely watch my or other webinars about costs. I've done a whole webinar on that, and I'm not saying that will answer your specific questions, but it will certainly give you things to look for and questions to ask. But I'll give you a summarized version now. In the UK, I know you may not be in the UK, but I think the principle is the same. In the UK, it's a requirement for the clinic to say, these are the treatment options that are suitable for you, and these are the costs that are associated with them. And then you need to use the hidden cost kind of detector, which is part of the BS detector, where you say that cost you've put down there. So they may have given you that list of costs. Let's say it says, embryo freezing. And then you need to say, well, hold on, I don't see anything about storage. So is that included or is that not included? You need to ask more questions. Because, if your question is, are they being transparent about my treatment options? Like, is it the right treatment for me? That's a slightly different question. If this is really about costs, then I would say you're asking them to give you what in the UK is called a costed treatment plan. These are all the things that I'm likely to have. These are the actual costs associated with them. Maybe a range, because if it's like, oh, we charge per embryo for freezing, just as an example, then obviously they can't give a final number. They'll go, it's as low as 200 and as high as 1,000 or whatever. So that's the way to make sure it's transparent. But I definitely recommend watching the webinar about it, because there's a lot to it. Hidden costs, add-ons, should you do them? And hidden costs is one of the major ones that people complain about. And I'm going to repeat the thing about communication. If you get in writing from them, you will only pay X for this treatment. If you end up being charged more and it's not clear why, you go back with that email and you go, you said I was going to be charged X, and now I've been charged X plus Y. And I've worked with a number of clients who've said it just wasn't clear what I'm paying for. And I asked them to go back and clarify things with the email, and they got either money back or refund or whatever. So most clinics will not fight hard against written documentation that looks like they haven't done their job properly. But you not being clear about it at the beginning, I didn't really understand it, that's not usually sufficient for them to start handing out refunds, in my experience. So that next question about billing incident, thank you for sharing that.
Exactly.
But 3 means you did resolve it, so that's good. So you tuned into it, you questioned it, and it was resolved to your satisfaction, which is good. But make no mistake, this is not an infrequent thing. So when I worked for the HVA, which was quite a long time ago now, but I would say this was the number in the top 3, number 2 maybe, of complaints from patients was the not just being charged a lot, but not understanding why they were being charged things. And at those 10 years ago, I would say that was because the systems were terrible for billing in clinics. They were just prehistoric, really, really bad systems. Those have improved, but there needs to be a lot of joined up thinking between what you were offered, what you were told, what you signed up for, what your plan said you were going to have, what actually happened on the day, how many embryos, sperm, eggs, whatever unit you're talking about was processed or frozen or biopsied or whatever. All those things have to join up. I know it doesn't sound like rocket science. It's not. But if those things don't join up, that's why you end up with an incorrect bill. And I would say it has been in the past very common. So almost certainly, just like when you're at a restaurant, I don't know if you're one of those people. I am. If I'm at a restaurant, even if I've had quite a lot of things with the group I'm with, I always check the bill. And it's not because I think they're automatically dishonest and they're going to add on an extra bottle of wine, but it's not. But as I was watching a webinar from an author actually talking about publishing and the money from selling books, and he said, I think a lot of mistakes are made and they're never in my favor, which is what he said. So I would say the mistakes that are made are probably never in your favor. So think about that, and check your bill really carefully, as you did. Well done.
Yeah, definitely. Thank you so much for sharing as well. Yeah, so you just mentioned this, but there's a follow-up here. So should I confront them? And you already mentioned that. So thank you so much for this. And one more thing I think we can still talk about. So we don't really have another place to go. So we still need to proceed with them. Anything you can
Yeah,
add
I mean,
to that?
it really depends on what the kind of red flag is, and I'm not trying to poke you to say what it is at all, but I mean, I'll give some examples maybe. So a red flag of I'm getting inconsistent information. I think you just come out and say it. You just go, well, look, this doctor said this, and write it down, of course. Say it and then send it in an email. This doctor said this. This nurse said this. I'm just using an example. This one said this. It's kind of driving me crazy. I'm frustrated. It's already, you just say all that stuff. You don't need to get, angry or anything like that. You just say exactly how you're feeling. Don't ascribe any emotion to them or any blame to them. Just say, this is how it makes me feel. So they should be really clear about what this is doing to you. Of course, they've got a lot of experience and they should know that already. But you saying it is saying, this is where I am. These are where the stakes are right now. So that's a really trivial one. I mean, an important one, but trivial in the scheme of things. A red flag, like I just read your inspection report that, you've had loads of incidents and you're on a warning and you might be closed down soon. I think you confront them and you say, you confront them, but in a slightly different way. You say, I've just read all of this. I need to know. I need some confidence that this is okay to stay here. What do you say to that? And I would go for that type of one. I would go to the top. You go to the person responsible in the UK, for example, or the medical director, or in another country, the medical director, because they don't have all the same positions in different countries. Go to the top person and say about a really high stakes thing. This has really knocked my confidence. I'm, I don't know what options I have. What can you tell me to reassure me? If you do have the option of going somewhere else, you have the same conversation, but say, I'm, unless you can convince me to stay, I'm afraid I'm going to need to have to, move elsewhere. Now that is inconvenient for you, but you may not have money, embryos, years to play with. So you may need to do the right thing for you as quickly as possible. I know that's a bit of a vague answer, but red flags come in lots of different flavors. And if you if privately you want to share that with me and see how to deal with that, but I think it's good that you're even using the word red flag, or maybe you got it off me, but it's good to see it that way, to say this is something that is waving in front of me, it's bothering me, and I need to do something about it. I certainly wouldn't ignore it.
Sounds about right. Thank you so much. I don't see more questions, but I think it's still an interesting conversation. And I also want to add that, remember that if there's anything that you want to share, you can still do it. If not, you can always get in touch with Alan, and I'm sure he'll be happy to share his expertise as well. And I also put the link, and of course, as Alan mentioned, we had a few webinars before on many aspects, personal boundaries, but also IVF and money, etc., costs. So if this is something that you want to find out a little bit more about and you missed the previous webinars, you can go to our website and all information is there. All the webinars are also there. And I'm sure Alan will be happy to answer any of more questions for you. And I think we will be finishing for today, but before we do, Alan, any final thoughts? Anything that comes up for you and you wish to share on this particular topic?
Yeah, I mean, I suppose to summarize, it's good to have support. So somebody who's got your back inside and outside the clinic. Inside the clinic, if you can get it, that's great. But you do have to, be your own advocate, unfortunately, and you do have to. Well, I mean, I think the best example, but you expand this to all the aspects of treatment. Ask yourself the question: am I the person who checks? I'm using the costs as the example, right? But am I the person who checks what I've been charged when I go to a restaurant? If you're not, that's a different personality type. I understand that, but I would say when you enter the IVF and the fertility treatment arena, you've got to start becoming that person. And I'm using the example of, a service and a charge, but you see what I mean? Expand that to every aspect of your treatment. They've said I should do this and this. Does any of that not sound right? I spoke to someone last week and they're having a different treatment. Does something not sound right here? Ask the question. Just say, oh, well, my friend had almost exactly the same symptoms, blah, 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 and they got this. And a good doctor will go, oh, yeah, well, here's the explanation. And, a not so good doctor might say, well, look, we're talking about you, or just shut you down, or, you know what I mean? You've got to, your questions have to be listened to and responded to correctly. And as I've summarized before, they usually end up being, why am I doing this? How much is it going to cost? Exactly what's it going to cost? What's the benefit? What's the limitation? Are there any side effects? How many times have you done this before? Is there evidence at your clinic, and is there evidence outside? Those are the questions off the top of my head. They apply to almost everything that you can do in IVF, but they more apply to things that are slightly off the routine. The routine stuff is routine because that's what gets done all the time, and for a reason.
And there are no wrong questions indeed. So it's better to ask too many rather than not to ask, and then
I mean, that's a great point, Caroline, because you've got to remember that the people you speak to have done this thousands of times before. That doesn't mean they're perfect, but they've done it thousands of times before. So they've heard the question before. It's the first time you're asking that question, so it's really high stakes for you, and you want to know the answer. You deserve the answer. Simple.
Definitely. Thank you so much for this summary. Sorry. Definitely, it's something that we could go on and keep on talking, because of course this is not black and white for sure. I'm glad that we are discussing this. Thank you so much, everyone, for joining. I believe it was useful for you. Before we finish, Alan, we would like to also invite you for our next event that will take place next week. And actually, Alan will be hosting that event. So, Alan, over to you. Any few words?
So this is I don't know if any of you have been to one of these events before, but they're very good. They're Q&A sessions, so it's no presentation, just Q&A, just questions and answers. Sorry, I've got to stop using abbreviations. So we'll have doctors from 3 different centers. I've hosted quite a few already. I think they're really good. We get lots of different questions, and sometimes I try to be the moderator who keeps things under control. Don't let too many random questions in. But this one, it's very broad. What factors affect my IVF success? That's huge. So if you've got, honestly, I think it's worth your time. If you've got a very specific question, and it's to do with, this topic, which pretty much everybody who's going through IVF has that question, really. I think it's worth doing. And also, you learn from other people too. So, someone else might ask a question. You think, oh yeah, actually, I would have asked that. Oh, great. What are they going to say in the answer to that? So, I think it's an hour well spent if you can spare the time. Look forward to seeing you there, some of you.
Yep, we will be here actually next week on Tuesday. There is a link in the chat, but of course, if you go to our myivfenses.com website, you will find it there as well. As you see, Alan will be hosting 3 different doctors, 3 different clinics, 3 different countries. So, of course, I think that you can find this very interesting, and I can only encourage you to sign up. 8 p.m. Central Time. So if this is something that you are wondering about, or you have some other questions, I can only encourage you to sign up for it. And that will be it for today. And lastly, I want to add that after we finish, you will be redirected to our survey. So please share your thoughts, please share your feedback. We appreciate it. We want to grow, we want to explore, and want to see your answers as well on this webinar, but of course on our previous webinars as well. So let us know what you think. That would be great. Thank you so much. Have a lovely evening, Alan. We will see each other next week, of course.
Yep.
And everyone else, of course, I hope you will be able to join us as well. Have a lovely evening and take care. See you.
Thank you. Thanks, everyone. Bye-bye.